Regional One Health is set to get a major facelift with a price tag in the hundreds of millions, making it one of Shelby County's most expensive capital projects. The first of the project's 3 phases has the green light thanks to the wheel tax increase commissioners passed back in June. An increase taxpayers from our Let's Talk Town Hall in Fraser want put to good use. I sat down with the hospital's CEO, who shows you an idea of the plans to make your money worth its while.
This is a 1950s building, so we've redone it as many times as we can.
Out of the office and hitting the streets, President and CEO Dr. Reginald Coopwood steps away from his desk to show us his vision for Regional One Health.
Everything in here will be replaced really in building 1. Then this building comes down.
He points out the hospital's labor and delivery building facing Jefferson Avenue, which will be the first step in rebuilding the medical center.
This will allow us to do phase 1, which really replaces all the things in which our women's hospital, our L&D, our NICU.
The price tag for the first of 3 phases is $350 million. Coopwood estimates the project's total cost will be about $800 million.
And we're talking about complete building up, tearing down, and creating a new campus. It's about 8 to 9 years total.
There are layers to this project. First, Shelby County government committing to the $350 million over 5 years. Commissioners recently passed the $25 wheel tax increase. That brings in $15 million per year to go towards construction, an effort Coopwood worked tirelessly on with Mayor Lee Harris.
And after 22 years of no new revenues, for that couple bucks a month, Regional One will stay open and it will thrive.
This vote that was a positive vote followed 2 negative votes a couple weeks prior, where we thought we were in a good position and we didn't have the votes. So when we finally were able to pass it, it was overwhelming.
Taking the economic impact even further, Harris wrote a letter to Coopwood requesting a commitment to hire diverse businesses for the construction job.
Number 1, he's got to appoint an executive level member of his team to respond to minority contracting, to oversee the minority contracting portfolio.
We will create the position. We've talked to a few people. I don't have a grand announcement today, but I think within the next 30 days we'll be able to identify that individual that will help.
Harris also requested that priority hires for the 600 hourly jobs paying $25 to $30 an hour will come from Memphis's underserved areas.
So we've identified 6 of the most impoverished zip codes in the inner city of the city of Memphis, and we're going to make sure that those folks have an opportunity to get the high-paying hourly jobs that are going to come from this 5 to 10 year project.
There's nothing in the letter that I disagree with. It's important that we make sure all individuals, all businesses, all people within this community benefit.
As we made it over to Dunlap Street, Dr. Coopwood, a man who I can't say was particularly happy to do this interview at first, was all smiles when painting the picture of the final project.
Parking lot, that building will come down. It'll go all the ways to Madison and into here. And then we'll take down the route center and build building 2 right here, and it'll all be facing
this way.
Right.
And that's past phase 1.
That would be that's phase 2. This side is phase 2. And phase 3 is in taking down all the old buildings and creating a nice campus.
Have you seen it in your head when you pass by?
I have. I wake up to it every morning.
Well, the proposed design pictured is only an idea of what the buildings could look like. Architects have not been hired yet, and it's still too early for a timeline on when construction will begin.